what we are feeling and experiencing beyond our medical symptoms are factors. They are huge factors. Mental, emotional, spiritual, cultural, all of those aspects of our lives play a key role in our outcomes and in our treatments.
We serve a diverse population over a large geographic area, but care also needs to be personalized. Applying AI on our vast pools of data enables us to do that in a way that is meaningful at a system, community, and patient level.
To unlock the potential of artificial intelligence in healthcare, we must use it to serve a clear purpose. We must use it when and where it can deliver tangible benefits for better care. That's what we do at Siemens Healthineers, and that's what we are helping our customers to do across the globe. It's inspiring to see how AI is already making a real difference, freeing up employees' time by automating routine tasks, enhancing access to a more personalized medicine for more patients, and helping hospitals to improve operational workflows, improving efficiency and outcomes. Let's take a closer look at how AI is creating tangible impact and improving lives of patients. Welcome to our latest Shape 25 Spotlight.
Automating workflows.
The reason we are actively embracing AI is clear. The demand for imaging in medicine today continues to grow. So without optimizing the way we operate, it's not possible for us to meet this growing demand. At the same time, we want to offer the most personalized diagnostics for every patient. AI allows us to tackle both of these conflicting goals, streamlining processes and providing more individualized diagnostics without introducing additional complexity into our workflows.
The defining step for the entire diagnostic pathway is the selection of the exam protocol. It must fit to the patient, to the clinical context, and to the scanner that's being used. We have developed a prototype for the next generation of workflow automation. It leverages large language models to optimize this crucial step in the protocol selection. It enables maximum personalization while at the same time maintaining optimal quality.
AI is already adding enormous value by automating individual routine tasks. The next step will be to use AI to automate entire phases of the imaging process and having them operate as autonomously as possible. That would allow me to devote more of my time and attention to complex cases and, most importantly, to my patients.
Personalizing care.
Right now, some of our biggest challenges are wait times and access to care. The ultimate vision is to improve the trajectory of cancer care for patients in Alberta, which means ensuring patients have access to state-of-the-art care when they need it, and that we tailor it to meet the needs of individual patients.
I was diagnosed with a rare form of brain cancer in 2013. My main goal was to be around for my family, especially my then 3-year-old daughter, for as long as possible. So I was fortunate that by the time I finished the radiation part of my treatment, which was 6 weeks, and I received a new care team. In fact, they fully engaged me and invited me in. It gave me the comfort in knowing that I did have ownership over this cancer and it wasn't owning me.
Using AI on large data sets enable us to embrace the complexity of cancer care. Our current work includes over 300,000 cancer diagnoses, approximately 13 million cancer-specific visits, 200 gigabytes of lab data, and more than 7 million imaging encounters. That's the magnitude of the data we're talking about to implement what we call precision analytics, which includes predictive AI modeling. This allows us to improve our decision-making about resource and staff allocation, and it will help us to expand access, reduce wait times, and improve care.
Cancer is a non-linear disease. With artificial intelligence, we can overcome the inherent limitations of linear models. My research focuses on radiomics, using imaging to predict outcomes. We have built an AI model which extracts more than 5,000 features from CT images to predict survival outcomes in patients. With our early data, the model is already a better predictor than staging. It goes beyond looking at the cancer alone, but rather also at the overall condition of the patient.
To me, the best way that care teams and health systems can support the cancer patient is recognizing that the cancer patient and their families are the experts on them. And we know what we're feeling, we know what we're experiencing. When we are listened to, heard, and engaged, we feel empowered. And by feeling empowered, we are able to face cancer on a much stronger stance.
Time is precious for cancer patients. Increasing the pace to implement innovation, that's not just an option, it's an obligation we have to our patients.
Transforming departments.
At Siemens Healthineers, we have a long history in AI development, and we keep pushing the boundaries on how AI can fundamentally improve healthcare. Common provider challenges are long waiting times and patient backlogs. Operational twins of entire hospital departments are a powerful system to address these. The operational twin is a virtualization of a department processes and their dependencies using input from multiple data sources. This can be extremely complex. For example, the staffing of shifts alone can have a very large number of possible permutations. Using AI, we can manage the complexities of reality in a virtual environment. Billions of scenarios run in parallel on our Sherlock supercomputer, and this data is used to build the AI agents that optimize the set targets, like reducing patient waiting times under dynamic conditions. The system derives the best strategy based on a simulated experience of millions of years. It runs real-time scheduling and proposes improvement measures for the department, illustrating why certain strategies are preferable. Combined with expert guidance, the operational twin provides a simulation environment before adopting the AI agents into the real-world setting. We're doing this today at the department level. Now imagine the impact when expanding to multiple departments, hospitals, or even hospital networks.
At Siemens Healthineers, we know that AI is a powerful tool. It's an enabler of real, lasting impact, one that helps us unlock efficiencies, transform healthcare, and scale medicine. Our approach is truly global. Our research and development teams collaborate with a vast network of partners. This ensures that our AI-powered solution reflect local realities and serve the diverse regional needs of healthcare providers worldwide. For instance, hand movements are reduced for abdominal ultrasound exams by almost half with AI abdomen on Accusound Sequoia. MRI acquisition time is reduced up to 72%, enabled with deep resolve AI-powered reconstruction. Sample handling that is over 5 times faster than traditional automation tracks is provided using sample routing prediction algorithms on Atelica solution. Interventions can be 27% faster by integrating diagnostic imaging data into interventional workflows with CT-guided PCI. In more than 50% of patients, plan quality has shown statistically significant improvements using Eclipse Rapid Plan. Equipment uptime is increased through predictive component monitoring by 1 day per event with TubeGuard, and many more. As we look ahead, our focus is clear. We believe that AI must do 3 things. Automate more than just individual tasks, but power autonomous systems helping us address growing workforce challenges. Infuse patient context across a connected care continuum to make care more proactive, predictive, and personalized. And finally, streamline operations at department level and beyond to scale access for patients everywhere.
The more and more we're seeing patients surviving and living with cancer versus passing is just proof that technology, cancer advancements, treatments are all coming leaps and bounds. And the future, I think, is going to come at a much faster pace and bring all of that to reality for so many more, so much quicker.